Okay, the most important rule in medicine is do no harm. In small animal medicine, the patient is often held by a loving owner. You get a steady IV line, a full history, and a cooperating patient. It's challenging but controlled. But in wildlife medicine, the rules are completely different. Your patient is a powerful animal that isn't used to people, and the very act of capturing and anesthetizing it is critical, a life or death decision. This is where standard protocol fail and specialized knowledge begins. With these few words, I would like to welcome you all to our very first session of our series, Species-Specific Veterinary Anesthesia in Wildlife. A special welcome to fourth year and fifth year students from Luana, Lilongwe University of Agriculture and Natural Resources here in Malawi, who are our primary host today. My name is Dr. Sela Malanga, and I will be your host today. All right, moving into today. Today is a very special day. We have two incredible wildlife vets. They are all wildlife vets, but there is something different about them. One spent most of the time in a clinic, and the other spent most of the time in the bush. Our first speaker today is Dr. Karin Lourens. And the title of her talk is Raptor Sedation and Anesthesia Practical Approach in Avian Medicine. A little bit about Karin Lourens. Karin is a co-founder of Johannesburg Wildlife Veterinary Hospital, and I can say she is a true powerhouse of clinical wildlife medicine. Up to date, she and her team has treated about 16,000 wildlife patients. I'm saying 16,000. Wow, that's a huge number and very impressive. Yeah, this huge experience has made her an expert in treating animals like birds, reptiles, and pangolins. I can say she's literally writing a rule book for these species. Karin, we are so honored to have you with us today. But before I hand over to her, I would like to read out our learning outcomes. By the end of her talk, you should be able to explain the unique anatomy and respiratory physiology of reptiles and how this dictates specific anesthetic risk and monitoring. You should be able to understand how to select appropriate anesthetic drug protocols, premedication agents, and delivery method for safe induction of birds of prey. Thirdly, you should be able to apply techniques to minimize capture stress and establish effective protocols for fluid therapy and analgesia in reptile patients. Lastly, you should be able to understand how to conduct essential monitoring techniques and manage potential complications for smooth reptile recovery. Thank you so much. Now I'm going to hand over the screen to Karin. Karin, the screen is yours.
Morning, everybody. It's always weird to look at myself while I'm talking. Thank you very much for joining. I'm not going to say much about what our hospital does. I think you guys can go and look on our website. So just in a short, the Johannesburg Wildlife Veterinary Hospital does small wildlife and small and medium South African indigenous wildlife. So no one has an owner. We're a non-profit, and so basically anything that is injured from a 5-gram bat to a 2.5-meter crocodile, we treat, and anything in between. But we don't do, you'll see later with Dr. Chris, we don't do the big things like rhinos and elephants. Most of our patients can't squash us. They can bite, but they can't squash us. So the topics I was asked you guys to chat to you guys about is basically Raptor anesthesia. So 35 minutes is very short for bird anesthetics. So this, I just want to emphasize that this is basic and just the sort of start. There's lots and lots of reading things. I can give you a website at the end that will give you more information, especially on avian anesthetics. So, but raptors are often very similar to other birds, with a couple of differences. And then anesthesia and analgesia is sort of goes hand in hand, because normally when you do an anesthetic, it's for something that needs help. monitoring, and then recovery, and then a few extra tips that I've learned over the years that help us and them feel a little bit more secure and safe when we handle them. So first things first, I know we're doing anesthetics and stuff, but the most important thing when it comes to wild raptors is the handling. The first thing you do. So you'll see there's 3 different sizes of raptors, and each with its own unique issues. The one on the left is a secretary bird. They don't normally bite, but they kick. So that's why I'm holding his legs like that, and his wings as well. Because flapping can hurt them. The legs can hurt him. And if you hold a bird like that, they also feel more comfortable. And the one in the middle is a Rose eagle. They are massive. If you can look at their feet, if they get hold of you, they can literally break your arm. So they also rarely bite. It's mostly the feet. So with raptors, blanket rule is feet. If you have the feet secured and the wings and the tail, then you're sort of okay. Sometimes they bite, especially the smaller raptors like the kestrels and the hawks. They bitey as well. And the one on the right is a pearl-spotted owl. So for me, raptors includes owls. So I'm going to put them in as well because we see a lot of owls, and I think you guys will see more owls than you would see other raptors. So you can see there's a tiny little owl. Again, we call it the lollipop hold. Most raptors you can hold in that way, unless it's as big as the one in the middle. Again, holding the wings, holding the tail, and holding the feet. It's comfortable for them, especially if they have something like a broken wing, because if you hold them and they flap, they will damage that wing even more, and sometimes severing some nerves or arteries while you are busy. So this is everything just secure. You can look at them, you can look at the mucous membranes, the eyes, everything else, and then one wing at a time. And I know people think this is the boring bit, but actually with birds, this is very, very important. So this is very short. I would encourage you guys to go and read on this because birds are phenomenal creatures. Just to give you one example, a Himalayan geese, they can fly 7,000, it's like 7 kilometers in the air. They fly over the Himalayas, so over Mount Kilimanjaro, and they breathe normally. That is an extraordinary feat, and it's all to do with the air sacs and the lung and how they work with the lungs. And the oxygen exchange. So, most mammals have elastic lungs. We have a diaphragm that helps us breathe, but avian lungs are very small and they're rigid. So, and they're almost stuck to the inside of the ribs. And they are the site of gas exchange and contains millions of tiny interconnected tubes called parabronchi. And they have a large surface area. So how birds breathe. This is a very simple diagram, but guys, again, go read on this. There's so many literature on this. It is absolutely fascinating. So basically when the bird breathes in, you look at the blue little line, the first breath moves into the air sac. Then the first breath in, then they breathe out and air moves into the lungs. Then they have a second breath and air moves into the front air sac, and second breath out, air leaves the body. So basically they're almost breathing twice. And this is very important when you do inhalation anesthetics. Imagine, they're actually breathing the anesthetic in twice. So it's very important to watch that. In addition to oxygen absorption and carbon dioxide release, this system helps with thermal regulation, detoxification, and acid-base balance, and also houses the syrinx, the organ responsible for a bird's vocalization. So please go and have a read. I know a lot about this, and before this talk I also read some more, and every time I read it I'm fascinated. So sedation, just so you know, that is not a sedation that you have to decide what ready off. You obviously don't need IM or IV or anything that lasts longer than 15 minutes. Premedication for surgery is important. Long ago, people didn't used to use pre-med, but when it comes to birds, again, raptors not really, but you get things like diving birds, and diving birds hold their breath. So if you put a mask on them, they'll just sit there and look at you and not sleep. So pre-medication for birds like that is very important. And it also reduces the stress a lot. I'll show you some drug choices. Obviously, those are not the only ones, but those are the ones we use in our clinic. And each patient is unique. For this little owl, when it's about 2 weeks old, maybe even less, you would use a different type of anesthetic because they're young. So I know they're birds, but think of them in the same way that you think of mammals, like a baby cat and an adult cat and a very elderly cat will have different anesthetic protocols. And whether they're sick or injured, their age, everything is important when you consider what to use as a sedation. So for sedation, the most common in use is actually people use gas with a mask like this. Isoflurane we have, and then one day when we're adults, we can use sevoflurane, which is better, a bit more expensive. Isoflurane is very safe, it just smells terrible. One of the other things you can use is a so intranasal sounds strange, but again, in a very stressy bird, it's easy to do. And especially when you do blood work on your bird, even one intramuscular injection can put their creatinine kinase through the roof, which shows muscle injury. So even one injection can push it over the limit. So, and it's painful, but intranasal is good and it's easy and it's fast, but sometimes the bird sneezes or they swallow it and then it doesn't work. So again, I often use IM, especially if it's not going to be a once-off, and I'll use obviously the smallest needle and you inject into the pectoral muscle. For long procedures, those are things like orthopedic surgery. We use a pre-med. Again, it depends completely on your patient's health status. So the first one, the 1 milligram a kilo butorphanol and 3 milligrams of ketamine and 0.04 milligrams of medetomidine IM works brilliantly. But be careful with medetomidine. We've had it often that they actually, when we get into theater, they stop, their breathing decreases and they go too deep. Then you can reverse the medetomidine, especially if they're on gas. Or another one to use is wonderful. It's ketamine and midazolam at that dose. Also IM. It makes them sleepy enough so you can do an IV line because that is very important as well. And also, sometimes they're sleepy enough that you can intubate them without having to gas them for a bit. And for me, it's very important that you do an IV line. And it's not that difficult. I'll show you how. Like any other animal under anesthetic, if you do not have an IV line and that animal crashes, there is very little you can do. And the fluids are ringers or saline. There are other combinations as well, but most practices have these. So analgesia. And yes, birds feel pain. I know I'm preaching to the converted, but there are a lot of older vets that believe birds and reptiles don't feel pain. Just because they don't show pain like mammals do, and especially wildlife, they don't show pain at all. So normally a wild bird will pretend that it's healthy and happy. And the minute, because when you're looking at it, because again, in the wild, if you look sick, things are going to see you and think, I can eat you, or you're vulnerable. Whereas when they will then sit in front of you and sit up straight and look healthy, and the minute you go away, they like all crumpled and fluffy and look sick. That's why many exotic vet hospitals have a one-way glass, because even parrots do that. It's a natural instinct. So if this is my sort of tip here, if a raptor comes in or any wild animal and displays abnormal behavior, like very sleepy, like they don't care anymore, that animal is in real trouble and needs immediate care. Because you will learn as you work with raptors, like for example, marsh owls. They are tiny. I call them the chihuahuas of the owl world, because you can literally drive over them with a truck and they will still try and kill you, even though they're so small. So they are quite violent. So one of the things we look at, if you handle them and they're not doing that, then there's something wrong. Again, same with barn owls. They're very easy. If they don't eat, again, they're either very compromised or blind. And things like fish eagles, they are called quite gormless. They'll just sit there in their cage and stare at you like a weirdo. And some like like a yellow-billed kite, for example, they do catatonic. They'll just basically open the door and they lie flat in there and you think it's dead. It's normal. They just do catatonic sometimes. So just the normal behavior of your bird is important. Just know them and learn them as you go along. Like we've done 16,000 animals, of which 72 different species, indigenous species. So it's important. You obviously learn as you go along. And if you could see, this is a fish eagle. He was in a fight with another male fish eagle. Thankfully, none of his important structures were damaged, just some on his nares and face. So in birds, the birds don't respond to mu opioids, agonists like mammals. They like more kappa type receptors. So the best opioid for me, in my opinion, is butorphanol. It says 1 milligram a kilo, but you can actually go up to 4 milligrams a kilo. It's a wonderful pain medication. And if you have it in your pre-med, it's even better because then you have a pre-med and a pain killing drug. Tramadol is sort of new. In previous literature, it said that it shouldn't really be used in raptors. Some new literature says you can. I'm a bit loath to use it because I find butorphanol more than enough. But again, it's commonly used in other birds, especially parrots. Then meloxicam, that is a massive dose. And yes, it is right what you're reading, 1.5 milligrams kilogram BID per os. So we use meloxicam syrup. It works like a charm. It's easy to give it to them, especially if they eat well. You can put it in their dead prey, just inject it into the dead prey, and they'll eat it. But only when it's hydrated. Remember, guys, this is a non-steroidal, and it can have, if you're dehydrated or in shock, it can have effects on your kidneys, your stomach lining, and all sorts of other clotting factors, all sorts of things. So it is a wonderful drug to use in birds, but only once hydrated. So when you get a bird in that's in shock and needs medical attention immediately and is in pain, butorphanol is a great drug. We've also used gabapentin with great success. It's also a nice calming drug. So if you have a very stressed bird, you can use that as well. Ketamine, more and more popular, but use a tiny, tiny dose. I start with the 1 milligram a kilo, otherwise they get a bit sedated. But if you have someone with like a humerus fracture, for example, or a femur fracture, it's very painful. Use multiple drugs. You can use butorphanol, meloxicam, gabapentin, and ketamine all in the same bird if they need it. And then eventually what I do is I normally stop all the opioids and just carry on with meloxicam once they're more stable. And then fluids. I cannot stress enough. You have to have fluids. And I think this goes for every animal under anesthetic. Always have an IV line. So IV, I'll show you the pictures now and how to do it. I use the medial metatarsal vein. It's on the leg, on the inside of the leg. It's easy. They don't bother with it, and it can be strapped in, and especially in long-legged birds, it's quite nice. The ulnar vein is more for me for taking blood, because if you have a Jalco or a catheter in the ulnar vein, they often flap and the whole thing falls off. The jugular is used sometimes in parrots, but we don't normally use that in wild birds. And then subcut is another way, maybe if you're not really okay with IV, but again, I prefer IV if you're going to do lung sedation. But again, subcut works really well for birds that come in and they need fluid, but not necessarily IV fluids. I'll show you there as well. I only use the inguinal region, and you use a tiny needle, and you can go up to 10 milligrams a kilo, and then 5 to 10 milligrams per kilo per site. Otherwise, it's too much in one spot. And then intraosseous, I mentioned it here. I rarely use it. I probably have used it in like 5 cases. It's normally when they come in totally collapsed and you cannot find a vein. It's rare to not find a vein, but at least then you can get fluids in. There are other sites like the proximal ulnar, but it's not something I would advise. And this is more for animals that are completely comatose, because sticking a needle in your bone is very sore. So this is an emergency situation, or when they're already asleep. And I'll show you where to do that as well. And what I do with my anesthetic cases or long procedures, I always see the bird as 5% dehydrated. And because wild birds stress more, this is to help with that stress as well. It's not just maintenance like a cat or a dog who likes being handled. These guys don't. And then work out the fluid rate. And these little syringe drives are amazing things. You can set it to 0.4 mils an hour for tiny things. There's just a little table on what I use. But yes, you have to, when you work out things, consider all of it. So normally, let's say the bird comes in, it's dehydrated and sick, you use rehydration replacement and you add the maintenance requirements, and then you divide it into the hours that you want it to be. Birds can be overhydrated quite easily, so make sure you work out the fluids correctly. And then this is the intravenous fluids one. This is a medial metatarsal vein. So this one was easy because it's a tiny little one, tiny little bird, little raptor. You can see it's a yellow gelco, but it works. So try the biggest gelco you can get in. Obviously, if it's your first time, try the yellow one. But in big raptors like that secretary bird, you can use a pink one. And they do that in human medicine as well, other medicine too. You put in the biggest bore catheter you can, because if you need fluids, you need it to go in and not like trickle in. And then this, I find, especially with birds that stay on a drip, this is the best site because you can tape that closed and they almost never bother with that catheter and they can still perch. Whereas if you put it on a wing, there's no, let me show you. That's the ulnar vein. So you can take blood from it, but you can imagine it's a very flimsy little vein. It blows easily. I use it normally to take blood for tests or anything like that. But if you put a gelco for me or a catheter in there, you can't really put plaster around the wing. So you almost have to stick it on and it comes off very easily and it's uncomfortable for them. Whereas I find that the leg vein works really, really well. And just to show you subcuts, and if you zoom in a little bit, you'll see the one on the left is a tiny baby barn owl. I'm not injecting into its abdomen. I'm just trying to show you what I'm doing on the right. So you turn the bird around. It's always nice to have someone help you. And then you find in the inguinal areas, the sites with no feathers. And you can just swab it with a little surgical prep or alcohol. And then just under the skin, you give the fluids. Because if you go too deep, you actually go into one of the air sacs. But if you can see your needle under the skin, and when you inject, you see the little blob come up, that is correct. This works really well, especially in birds that don't need shock rate fluids. It's easy to do. Anybody can do this. And you can learn. Don't do it on the back. We've had people do that, and then sometimes the fluid comes all the way here and sits here in a ball. So this is a very nice area, and it's very well accepted by the bird. And this is intraosseous. You can see on the right, it's the proximal tibia. So basically, you bend the knee as far as you can, and you stick the needle or the catheter in as far at the top of it all the way down. And obviously, a bone can't take as much fluid as like a 10 mils a kilo or 30 mils a kilo, even if you have to do shock rates. But this again, I would do only if you're really well versed in this and if you cannot find a vein, or in this case, where the bird's leg is so small you can't find it, then that works. And also, please remember, guys, there are pneumatized bones in birds. You'll see when you read more on their respiration, the two clavicle air sacs connects to the humeruses. So the humerus is completely, there's no marrow in it, it's empty because the air flows in there as well. That helps them fly. And the two abdominal air sacs link with the femur. So never ever accidentally put any of these things in one of those. The bird will actually drown and die. So anesthesia. Most people like using a mask. Sorry, I need coffee. But again, with certain types of birds, I've had vultures, well, not vultures, one or two vultures that just hold their breath and they just sit there and look at you. Diving birds, for example. So it's very safe because the minute you remove the mask, the animal exhales it and they wake up. So it is a safe way of doing an anesthetic, but I would, with an IV line and IM sedation or intranasal sedation, it's much easier because eventually you're going to intubate this bird. I'll show you now. And then with an ET tube. Always, always, always remember that you use an uncuffed ET tube in all birds and all reptiles. They have a complete tracheal rings, whereas mammals have one that would have a little muscle over the top and can stretch. That's why you can use a cuffed tube. Even if it stretches, it won't hurt. But if you do that in a bird or a reptile, it actually can cause necrosis, and that piece of tracheal ring can die. So this is very important to note. And you only put it in almost just halfway to the neck because their bronchi split quite quickly. And if you go too deep, you'll put it into one bronchi. And then we use a T tube. You guys should know about this, all the vet students. And the other tube in its mouth, I'll show you now. So monitoring. Monitoring is incredibly important. With any small mammal or animal, really, the smaller they are, the more conscious of its body heat you have to be. The smaller you are, the easier you lose body heat. You'll probably see with Dr. Chris, you don't actually have to have an elephant on a heating pad. It's massive with massive heat generating muscles, whereas tiny, tiny things will die if they're out too cold. So I am going to give you the basics of monitoring. In a lot of fancy, well-equipped exotic hospitals, they have capnographs, and we also have a little SPO monitor, but it's not very easy or very accurate in birds because it fluctuates quite a lot. So that thing that was in the birds, let me just show you again. The bird's mouth, the extra tube, not the ET tube, is an esophageal stethoscope. So it is a tube that is attached to a stethoscope, and you can place it into the esophagus, and it lies on top of the heart, and then you can hear the heart the whole time. They often use it in mammals. I love using it in birds because under anesthetic, you don't have to move the patient to hear the heart. And heart rate is very, very variable in birds. I mean, you can imagine a hummingbird, their heartbeat per minute can go over 700, 1,000 maybe, whereas a raptor has a heart rate of 150. So know the normal of your bird and know the normal of your bird, because you can't, there's not one single rule for every bird, but if you know the normal and the baseline for this bird, it's important because while they're under anesthetic, their heart rate will drop and their respiratory rate will drop. And again, you'll see the respiratory rate, small birds 30 to 60 a minute, large birds 50 to 30 a minute. It can be even lower than that depending on the size of the bird, and it will decrease. But the biggest thing during an anesthetic procedure, this is stable. So when in dogs and cats, you monitor and write down something every 5 minutes, you do this in about every 2 minutes in a bird because things change very quickly, especially with anesthesia. So 1 minute the bird is fine, and the next minute its heart rate is 12 and it's not breathing and its eyes are like this and it's close to death. And then bringing them back is very difficult because CPR in a bird is difficult. You cannot do chest compressions. Or you can try, but you will hurt them because their lungs are stuck to their ribs and there's ribs in the way. So please try and avoid this if you can. And this is why an IV line is important. You can reverse your medetomidine. You can give emergency drugs that way. And the temperature, their temperatures are high. 39 to 40 degrees Celsius is normal for birds. So that what that animal is lying on or bird is lying on is called a bear hugger. Please do not use a bear hugger just without that thing that looks like a mattress. It is specifically designed to be used with a mattress because that mattress actually monitors the temp and will regulate it. If you don't, then that heat comes in, just goes up and up and up because this tells the machine, please don't heat more. It works really well. In private clinics, they use one at a time. That's like 500 Rand each, but we often reuse them because you can wash them and it works really well. Also remember that birds during anesthetic oftentimes can stop breathing. It's not necessarily that they're dying. Some birds just do that. And remember, they don't have a diaphragm, so you have to ventilate them. And when you have an ET tube and that little T tube, you can see the little green bag, you can ventilate them quite easily. Obviously, when they go very deep, they can stop. But I've had diving birds that we've tried that you just have to keep ventilating because they just keep holding their breath because they can do it for so long. But it is something that you need to be aware of. And that's why monitoring them is so important every 2 minutes. And then recovery. You keep their heads elevated. You keep them warm. Again, 80% of anesthetic deaths in birds happen after the procedure because they stay people put them back in their cage, they're ice cold, their blood pressure drops and they die. They can die, they have organ failure. So warmth is important. So for me, I say they're using burrito style towel until awake. Basically, you take the little bird, you wrap it in a towel with just its head sticking out while it's sleeping. Because oftentimes when they wake up, they're confused and they flap and they can hurt themselves. So that way you keep them warm and you keep them contained. And you can reverse the medetomidine if you need to. Oftentimes I do it during anesthesia just to make sure that they don't go too deep. And the important thing with them is they really have to be able to sit up and stand up like the bird in the picture by themselves before you take that towel off, because they often hurt themselves by falling around because the anesthetic is still wearing off. And ensure that the carrier that you put them in are warm before. Put a heating pad underneath, and don't put in water like any other animal after anesthetic, because if they fall over and fall in it and can't get up, they will drown. And then a few extra tips. You don't need to starve exotic animals for long periods of time. During my readings, we don't work a lot with vultures, but vultures can be starved up to 24 hours a day. But small things, an hour max, because remember their metabolic rate is very fast. And if you starve them too long, they get hypoglycemia, and that's a whole other ballgame. And with wildlife, please guys, keep the noise levels as low as possible. It's not like a dog or a cat that likes people. Every single wild bird hates us, or hates us, and you need to. It's almost like you whisper all the time. It's very strange. When I go into a private practice and I hear everybody talking loud and the radio's on, it's quite loud. What else you also can do is, if you work with raptors a lot, you can buy some hoods that the falconers use to cover their eyes. But there's an expense, and if you don't use it often enough, the easiest thing to do is to put a little towel over their face. Because in any wildlife, I think Dr. Chris will tell you, you can try and keep the sensory input as low as possible. So sometimes in mammals, you put a cotton wool in the ears and you cover their faces. So to make all the sensory input lower, it brings the stress levels down. So cover their face, make sure they can breathe, make sure they're warm, and handle them correctly. And then I think I made it into 30 minutes. Any questions? And oh, before I carry on, sorry guys, that I got out of screen sharing now. Wait, I just want to show you that last slide. Just keep it on for a bit longer. So Lefebvre Vet is a very, very good website. It's an exotic animal website, but obviously a lot of exotic things are applicable to other animals as well. So if you go onto their website, students have free access, and they have articles on how to do anesthetic in snakes, how to do anesthetics in birds, what to look out for, the newest research. They even have videos on how to intubate and how to do a figure-of-8 bandage for a fracture. So please, guys, just do yourself a favor and read as much as you can. I'm going to leave that off. I see somebody has a question.
Yeah. Thank you so much, Dr. Karin. I should say this is giving the experience from the 16,000 treatment of the patients that you have treated, because this is very important and fascinating presentation. Yeah, thank you so much for the tips. You know, some tips people ignore them; they don't know that they are very important. But thank you so much for sharing the
You're
tips.
welcome.
Yeah.
I'm sorry it's very short. I can speak for days about this, but again, it's basic, and I do want people to understand that they should know more. It's not easy. Birds are
Yeah.
very complicated animals. They're breathing, everything else, and once you understand that, then you'll manage.
Yeah, thank you so much. All right, now we should get to the questions. I see we're already getting some hands up, and in the chat there is a question. But before I give Jairine an opportunity to ask the question, I would like to ask the audience, if you want to ask your question like by reading it out yourself, then you can raise your virtual hand. But if you are on a noisy place and if you like typing it, then you can type in the chat. Yeah. So
I
Jairine.
can also can I also just add my email address?
Yes,
And
please.
people can email me afterwards if they want.
Yes, please. That would be so helpful.
So, by the way, we also
Okay.
do internships. It's about 500 Rand a day, which is cheap for other places, but if you guys are interested.
All right. Thank you so much. That would be so helpful for our students. All right. I can see Jareen has her hand up. Jareen, would you please unmute and ask your question?
Okay, so first of all, I'd like to thank you, Joe, for a great presentation. Actually, I've really liked the presentation because I've learned a lot. So thank you so much. I have a question on monitoring anesthesia. You
Yeah.
said that during anesthesia, the the birds, the heart rate of the birds usually beat faster than the normal animals that the mammals and the like. So you said they can usually easily go into deep anesthesia. So you said in that case you can either reverse the drugs that you used to in anesthesia like the metomidine, or you can use the fluids that you were administering intravenously. So I wanted to ask that in a typical situation, approximately how long does it take for the reversal drugs to work? Because from the presentation, as you said, the condition can deteriorate like quite easily. I mean faster. So how long does it take
Yes.
for the reversal drugs to work?
Quite quickly. If you have a problem and it's really urgent, you can give it IV. I normally give the half a dose of the reversal IV. Um, But the thing is with them, so that's why we monitor. We do everything every 2 minutes because you can see immediately if there's a drop. Normally, if it's lower and it's stable, then you know you're okay. One of the things I didn't say is remember most birds have no eye; they can't move their eyes. So looking at an eye reflex is not going to tell you whether they're deep or not. Also, their palpebral reflex is also different to other animals. So the thing is actually to pinch their toes, and if they pull back, you still have pain stimuli, and that will go down easier. But I've had birds that slow heart rate, no pain stimuli, and the next minute they're sitting up on the table. So again, if you monitor carefully, you won't need that. But the reversal drug is important, but then also take them off the isoflurane and put them on oxygen immediately. That will also help.
Jareen, are you happy with that? Thank you so much, Dr. Karin. As I wait for another person to raise their virtual hand, then I will ask a question which is in the chat by Doreen Msosa. Doreen is asking, how do you assess dehydration in birds? That's a quite
That's a good
interesting
question.
question.
That's a good question.
Yeah.
It's difficult. It's much different in like an mammal. So the first thing you do is you can open the mouth. Normally, it should just open, but sometimes you get this stringy, sticky saliva that sits in the mouth. That means that animal is really dehydrated. They don't normally have sunken eyes, but and the best place to look is on the abdomen. So that a featherless spot on the abdomen, if it's really wrinkly, you can see it easily in baby birds. That means they're really dehydrated. For those, I would give IV fluids, but that is the easiest way.
Mm. Thank you so much. That was a good question. Thank you.
Yeah.
Yeah, I can see Dr. King Chidagwa is a qualified vet from Zambia, and he says, great presentation, Doc. All right,
Thank
thank you
you.
so much. Yeah. Okay, there is another question in the chat from Renette. Renette is asking, what would be your suggestion for getting into this field, specifically working with birds and raptors?
It depends on what you want to do. If it's normally if you have I think Lilongwe, you guys have a lovely wildlife rehab center in Lilongwe. You can get involved with them. But for me, It depends on where you work. So, like for example, in Saudi Arabia, a lot of people have falconry birds, and they have massive hospitals and falconry hospitals. You can work there. I don't know. Do you want to just work with wildlife, or you are you interested in other birds other birds as well, like parrots and things, or just wildlife?
Mm-hmm.
No.
Yeah, that's a question.
Yeah, it
That's a
is.
question for you.
Yeah, it is a bit difficult sometimes because we're a non-profit, so it's difficult to say do this and this and this. But remember, if you guys, your veterinary degree opens almost every single door and every single animal. Vets can do marine mammals, they can do marine, they can do fish, they can do birds. I have a friend in the UK who does spiders. So, it's open to anything and everything. And I would suggest that before you go, because before I did wildlife, I did about 14 years of normal small animal clinical practice. Do small animal clinical practice because it teaches you how to work up a case. Because it's important. How you learn clinical pathology, you learn how to interpret it, like CT scans and radiographs. But if you just hop into wildlife, oftentimes you don't do as much as you would in a small animal clinic, and then your knowledge sort of slips. We do a lot of workups like a normal hospital. That's why I like small wildlife. But yes, it takes a time, but I think there are places there that you can go to. If you Google, you'll see, I think Saudi Arabia, Dubai, they have falconry hospitals with internships if you like to do that. And that's like 2 months, and they teach you all sorts of things. It's really cool.
Thank you so much. And she has followed up with saying that she's from South Africa and very interested in working with raptors.
Okay.
Yeah.
Email me.
Renette, do you hear that? Email her.
Yeah.
All right. Thank you so much. And we have another question from Harry Maseko. Harry says, is there any specific reason why you cover the face of word belts when recovering?
I cover them all the time, not just with recovery. Because when they see you, they stress more and their heart rate goes up. And stress can kill a wild bird. So oftentimes when we get wild birds in, or animals that are sick or injured, we do subcut fluids. And if we really, really have to IV, you do a basic pain meds, everything, and then you put them somewhere for about half an hour so they can just calm down. Whereas in a dog and a cat, you can do anything immediately because stress, they don't mind it. They like people, but stress can actually kill an animal. That little bit of extra you do pushes them over the edge. So we never do radiographs immediately. We'll wait until the next day or even later. Stabilize them first. Don't worry about big diagnostics. Just get the bird to be stable before anything.
Thank you so much. All right. So I have a few questions as I wait for them to bring more questions for you and to raise their hands. Consideration when you're giving them injections, when you're giving belts, considering that they have air sacs, a lot of them, are there any consideration that you have in mind when injecting them so that you shouldn't hit the air sacs?
The easiest way to explain it, if you look at a whole chicken and you look at the two pectoral muscles, the chicken breasts, basically you go halfway down and sort of a centimeter away from that breastbone. And underneath this bone, you can't get it through the bone unless you stab the bird. So that's the easiest place, a small needle, and they tolerate it really well.
Thank you so much for that. All right, another one. What indicators do you rely on during anesthesia to catch early signs of respiratory compromise, given the unique air sac system?
First, auscultation is always a good thing. If they have respiratory compromise, I don't do anesthetic. I have another tip as well, which I've learned the hard way over the years, is if I have any raptor, especially things like black-winged kites, which are very stressy birds, I will not do surgery unless they have eaten by themselves. Because I find that if they don't want to eat and you get to stage where you have to tube them all the time, they invariably die after anesthetic. And what else did you ask? The breathing. So auscultate the lungs. You can hear crackles. then don't do a general anesthetic. It's the same as with dogs and cats. And if you have to, then isoflurane maybe, but only very light. But I would advise not doing a surgical procedure, a sedation, anything in a bird with lung problems. Rather sort that out first.
Okay. Thank you so much, Doc, for that. And there is another question from John Paul, who says, would you give some tip on stress monitoring on snakes, majorly pythons?
I can, if you want it. I'm happy to answer. I presume you're speaking about Southern African pythons that we have here. Stress, are you asking how to see stress in them?
Yeah, I think how to manage, to give some tip on stress monitoring. Yeah, how to monitor
Okay,
stress.
so pythons are special things. They will bite you, even though they're not venomous. They can give you a nasty bite. So, and they can also be quite dangerous. We have a rule that every 2 meter of snake more gets a person extra. So by the time you get to 4.5 meters, which we've had, you need 4 people in there because they can coil around you. They don't want to eat you because they can't, but they just you're in their space and they want to kill you. And if you're alone in there, it's quite scary. So with snakes, I also cover their faces, and also make sure you're handling it right. Don't hold them too tightly. Don't grip them. They're very sensitive with that. Also, don't put them where there's vibration because that's how they hear. Remember, they don't have ears, but they pick up vibrations on the floor. So if you put them, let's say, on top of a washing machine, that'll be like screaming in their ears the whole day. So put them somewhere quiet, somewhere dark. Always give them a space to hide in. They like to crawl under things and don't want to see. Don't keep them out in the open. Cover the front of their cage. And make sure that your handlers handling them know what they're doing. It's important to get that.
Thank you so much. Another question from Renette. Does the amount of air sacs a species have affect the amount of anesthesia used and its effectivity at all?
Not really. Most of them have nine air sacs, so I haven't worked with ones with more, but yes, I would think so because again, the rebreathing. The air sacs itself has no function in that, but it blows back the same air in and in. So the stuff that's sitting in the air sac is still, let's say, your five when you put your sitting machine on 5, but you've already put it on 2, but that's still 5 in there. So you have to remember that when you do an anesthetic.
All right. Thank you so much, Doc. Yeah, I can see we have no more questions in the chat.
There's one question from Dr. Boas. He's asking, I have a question since reptiles have little effect on mu receptor agonist. How effective is butorphanol? So for reptiles, I use morphine. Morphine works really well. Metacam works really well. The morphine dose is massive. It's 1.5 milligrams a kilo. Metacam is a bit lower. And I have never used atropine or carfentanil in any small animal. I think you can ask Dr. Chris that, but I've never used that. You can use it, but again, they can be quite yeah. So with birds, it won't work because only kappa receptors work, but not mu. So yeah, in a reptile, I often use morphine and ketamine actually works. Well, sometimes.
Thank you so much. I don't know how I missed that question.
No, it's okay. I think it was the first one.
Right. Yeah, reaching this sector, I want to thank you so much, Karin, for your time and for your your interest so much in it. And I know most of us now want to try and be the Bell's doctors just like you. Yeah.
Yes, read. I
So
encourage
thank
you guys
so
to read because the science changes every single day. When tramadol we didn't use when I was a student, it was nothing. Now and it actually doesn't work in dogs, they've decided, but now this works in birds. So keep reading. It's always fascinating to see what comes up next.
Yeah. Thank you so much.
You're welcome, guys.
Yeah, have a good day.
Let me wave. Bye.